just to start the presentation by sharing a little bit about, why SIRUM exists and kind of what drives the mission of our nonprofit, which is that you guys know this very, very well, given your work in the industry, but that in the U.S., about 50 million working age adults don't fill their prescription drugs due to cost. And half of them are actually insured patients. And so there is evidently this huge need for medications and medication access. But at the same time in the US, we have about $700 million of unused, unexpired medicine that goes to waste here in the US. And the number is even higher if you take in all under industries. I think it's about $5 billion of medicine waste each year. And so, there's this huge need, and then there's this huge surplus, and that's really why we as an organization exist. SIRUM is here as a nonprofit to basically use technology to connect the $700 million of surplus with patients in need, many of whom you guys are actually serving, and we applaud you for the work that you guys do. And SIRUM is really here to connect such as Sandy at Central City Concern with donated medicine so that you guys can continue to do the amazing work you guys do, but with more resources and support for medicine on your end. To date, SIRUM has redistributed over $4 million of medicine that would otherwise have been destroyed. We've been operating full-time since 2011, and this medication is enough to supply about 85,000 patients for about 2.5 million doses of medicine. And we're headquartered out in California. That's where we had initially started. But in just probably the last year and a half, 2 years, we have been able to expand also to Colorado, Ohio, and Oregon, where we're working with Sandy. And we're just extremely excited. Working in Oregon has been an absolute pleasure with partners like Sandy and others that we'll cover. And we're hoping to really bring this program statewide to serve patients across the state. And that's where we would really love to partner with all of you. And our work really wouldn't be possible also with some, SIRUM is founded or funded by some very generous foundations as well as other supporters. And this slide is just to highlight a couple of the ones, such as Robert Wood Johnson Foundation, California Healthcare Foundation, and others who have been really supportive of SIRUM's work thus far. And this is the exciting part is, you learn a little bit about what SIRUM does as a whole, but what does that really mean for you guys in Oregon? Since starting our work here in this state, we have had a variety of partners and supporters, and amongst them, the Board of Pharmacy we've worked closely with in implementing the SIRUM program through the Charitable Drug Program. And some of our big medicine donors, they consist primarily of long-term care pharmacies and some nursing homes in Oregon. And the biggest ones we have right now are Consonis and Payless, both based in Oregon that you guys probably may be familiar with. On our recipient partner side, we have Sandy at Central City Concern, and we've also partnered with Outside In as well as Providence, all three of whom are charitable pharmacies. Some of the benefits that you guys would receive as a recipient is, one, being able to reduce the drug purchase of your medically indigent patients. So we really are here to get you donated medicine as your supply so that you don't have to spend what you're currently spending on medicine and are able to expand that access for a larger pool of patients. And we know that for a lot of clinics, it's not just about the medicine. There are a lot of other parts of care that are important to a patient. So when you're able to reduce your drug purchasing costs through our service, you're able to either increase access and expand for even more medicine, or also redirect those resources to other areas of care that you guys really need as a clinic. And we're really here to help you guys support the work that you do. And lastly, just for you guys to know, SIRUM has been working closely with the Board of Pharmacy, and what makes the work possible on a legal context is the Charitable Prescription Drug Program, which we're happy to share with anybody who just wants a copy to see. But this provides liability protection for all of our participants, including donors as well as recipients. And so if you aren't convinced enough yet, we wanted to let you know that SIRUM isn't just here to get you the medicine itself. We really are an all-inclusive service. And so what we do is from beginning to end, so from the moment, if you guys have an interest at all for medicine, we are here to meet it and do whatever it takes to help support you. And that includes things like applying for the charitable pharmacy license, which Sandy is also our expert and an advisor and resource for those who are interested with an OPCA. So we'll help you with that, as well as any custom shelving and boxes you may need for the medicine, to technology and training, and all the record keeping that you will need for the program. We basically take care of all of that. So if you guys are interested, we want to be as inclusive as possible and accommodate any size of a clinic that you may be. To be completely transparent, we are kind of, as we're starting in Oregon, still in a pilot phase, but we would love to work with you regardless of your size. And so kind of the guiding principle we use just for the time being is if your clinic is dispensing and you guys are dispensing greater than 100 prescriptions a week, then we can work with you to connect you directly with our current donor base. If you guys see less than 100 prescriptions a week and are still interested, we would love to work with you. And I think what will be most manageable for you guys is basically for us to work on a system to transfer you manageable and smaller volumes to you guys as you're getting acclimated to the program, and then kind of ramp up so we don't overwhelm you all at once. There's a lot of medicine waste in Oregon, and I want to make sure that every one of you is able to tap into that as a resource in the long haul. Perfect. Yeah. Oh, and sorry, just to clarify with the volume, is that this is 100 prescriptions for your uninsured or your underinsured patients. And so I've done a lot of talking, and I do want to pause here and open up the floor to any questions that the audience may have. And if you guys would like, I'm happy to go in more detail over how SIRUM actually partners with our recipients when they're interested in signing up.
So, Amy, this is Ron Gelman, Lane County. I'm going to jump in real quickly. So this is a program really for programs who would have an in-house pharmacy. If you don't have an in-house pharmacy and you give sample meds, as an example, out, this doesn't really fit into that category. Is that correct?
So under the Oregon law, you would need a charitable pharmacy license, but we definitely have had interest from those who don't have a full-fledged pharmacy, but they dispense some medicine, some samples, and some other drugs as well. And one of them is actually working on a charitable pharmacy license right now. So in short, to your question is, no, you don't have to be a pharmacy right now. It does usually fit best for those who are dispensing in some capacity. And if you're interested, you could just apply for a charitable pharmacy license. I think they just ask that you have at least a pharmacy consultant on board.
Okay, great, thanks.
Yeah, no problem. Any other questions? Wow, I guess we were thorough. I'll wait maybe one more minute if anybody has a question, and then just so you guys have all the information in your toolkit, I can quickly run through just how the donation process works.
Amy, this is Matt.
Hi, Matt.
I think a couple people came on after Sandy had talked about how much it was saving them at Central City Concern. Do you remember approximately how much money that she said they're saving because of this program?
Yeah, she mentioned it saves them 50% of what they would otherwise pay.
Right, okay.
So to kind of help with that too, I know that weekly the cost of the prescriptions were somewhere around about $1,500 for the uninsured. So it is a significant impact, a weekly expense. But with the charitables, through SIRUM, we've cut that down to 50%. So that allows us to use money for other things, other projects, and help the patients better.
Thanks, Sandy. Did they answer your question, Matt?
It does.
Perfect. Okay, so I'll kind of wrap up here, just going through briefly kind of the process of how SIRUM works. I'm sure some of you guys are curious, and just to be fully transparent. So like I said, SIRUM is very much all-inclusive service. So once we set you up and help you with the charitable pharmacy license, what happens is we start with you. Because, you know, at the end of the day, we're here to not just get you guys medicine, but also in the U.S. to reduce medicine waste. So we don't want to be getting you medications that you can't use, which I know is sometimes happens with other programs. So what we do is we'll say, you know, CME, for example, a Central City Concern, what are the medications that are extremely useful for you and your patients? Either you guys just burn through tons of gabapentin or whatever high-volume drugs, or the really high-value drugs that otherwise it's really difficult for the clinic to otherwise purchase. So what we do is we create a custom formulary, and what you see here on the slide is purely a sample of one of our California partners. The list is actually much larger in terms of what's available, and we create this custom formulary based off your need. And from there, what we do is SIRUM takes care of all of the recruitment and training of the donors themselves. And so that way you can focus on just receiving and processing and dispensing the medication. SIRUM does all the logistics behind the scenes work to recruit and train them so that you just receive the medicine at your door. And just to be completely transparent, as of now the medications are coming in blister pack form. I think most you see that on the slide here, but we're working on ways to improve that in the future. But just so you know, that is the form that the medications are coming in, and then you're able to package them into vials for your patients. Then, just so you know how the medicine actually gets to you, is we actually have set up FedEx to pick up all of the medications directly from our donor facilities to you. And so what that means is that basically SIRUM never touches the medication. This leaves straight the hands of the donor to you. And I want to caveat this here first is that this is basically the process for some of the partners who are dispensing a lot of medications on site. If you guys are a little smaller, it may work a little bit differently, where we may have Central City or another larger clinic or charitable pharmacy package you smaller medications, and they will be the ones delivering to you. Like I said, donors send us donations to you through FedEx. SIRUM provides all of the supplies and the shipping service to make that happen. And what is also exciting is, just so you guys have full transparency over the medications being donated to you, is that SIRUM has a fairly easy to use online platform where you can actually track all of the donations that are coming through. So the moment the medication is shipped and then it's received by you, you're able to access it as an inventory system if you would like, and itemize all the medications that are coming in through your system. And lastly, like I mentioned, you're able to repackage the donated stock as needed into vials for your patients to dispense. So that's kind of the bulk of how the process would work. Again, I wanted to pause and see if there are any other questions. Perfect. Well, it sounds like there aren't any questions, but I wanted to at least share our contact information with everybody so that if you do have a question, again, my name is Amy, and we have George too, as well as Sandy as a resource. If you guys have questions as well, she's our expert. We would be happy to answer any questions, and if you are interested, really, if you have any need for medicine for your patients, regardless of how large or how small, we are here to meet them, and are really, really excited to hopefully partner with each and every one of you to get medications for your patients in need.
Amy, this is Ron Jellman, Lane County again, and maybe for Matt. Could you make these slides available, or I think I entered my email when I logged in.
Yeah, no worries. I actually I'm recording this, so I'll be sending out a recording of this to everyone that was invited, if that's helpful.
With the slides would be kind of most helpful to me to talk to our pharmacy consultant and a couple of the other team members about it.
Yeah. Matt, I can maybe, since you have the recording, I can send you a file with the slides, and you can maybe put that together with the recording to the members.
Sure.
Great. Thanks so much.
No problem. Perfect. Well, Matt, did you have any other questions or anything else I can help clarify for the group here?
I don't think so. The only thing that I didn't hear you say explicitly that I know you explained to Lori and I, which I thought was super helpful, was about, I think we were asking you questions about what does the setup process look like, and I think you had talked a little bit about how you guys really do a lot of the legwork in terms of helping clinics figure out the logistics of how to run this program in their clinic, and I just wanted to kind of just throw that out there again because I thought that was really important for people to understand.
Oh, yes, absolutely. Great point, Matt. So, like I said, we're kind of piloting this in Oregon right now, and we're here to just, if you have a medicine need, we're here to meet them. But what that means is also that we're really flexible. So I remember Matt and Lori have mentioned some of the clinics, if you are smaller and either with staffing or other areas, if you need any support whatsoever, we are here to support either with volunteer farm techs or other staff, as well as additional resources such as space or anything else we can basically do to help. If there's some kind of barrier that's keeping you from taking in the medications right now, you should definitely let us know, because more often than not, we have some kind of idea to help you guys at least lower that barrier for you guys to receive the medicine. And in terms of the physical setup, so there's a couple things. When you guys are on board, we set you up one with technology, which is a pretty simple, easy to access, directly off of any internet website. You can access our website to see the inventory and other things. We set up custom shelving and boxes. So these boxes are made to fit all the blister packs exactly, kind of all lined up, so it makes it really easy to receive and then sort out the medications, because we know traditional shelving may not always fit the blister cards in your dispensary or pharmacy. And yeah, so that's kind of the physical shelving. There's also, we provide de-blister machines if that's of help for any of the pharmacies, charitable pharmacies, once you guys are on board, to help with that process as well. Does that answer your question, Matt, or are there any other areas that I may have missed?
No, that's perfect.
Amy, I'd like to just chime in here a little bit about, how we're using some of the charitable medications and how important they are to Old Town Clinic. We have people who have insurance, and for some reason they lose their insurance. Lately it has been the Medicare Part B plans. Their copay, not their copays, but their monthly fees have gone up considerably. One went from $73 to $350, and that's just a lot of money for our people. So we've been able to use the serum medications to bridge these patients and keep them on their medications that they are accustomed to, so that we could figure out a way to find another insurance for them or have them figure that out. We also have a population that's always on the move. They come to this area and, they just are uninsured, and a lot of them have mental health issues. And this allows us, when they come to the clinic, that we can start providing medications for them and, look for insurance. But we don't have to deny them any medications. We can continue those real expensive mental health medications. So it's really provide a lot of continuity for care for our pharmacy and for the providers. And a lot of the medications that we get, like their gabapentin, which is very expensive, and that's a high utilized medication in our clinic. And with, everybody such a high usage of it, it costs a lot of money for those of us who are sponsoring that are uninsured. So SIRUM is, I just, speak very highly of them. They're so easy to work with, and they really try to match the drugs to your needs. And, so they have really helped our patients and ensure a better health care.
Great. Thanks so much, Sandy. That was super helpful.
Hey, Amy, there's a
question. Let's see that.
Oh, okay.
Perfect. I think it's a Melanie, right, who's asking the questions. There's two questions. I'll answer both of them. The first question Melanie had is, what is the turnaround time if we need to order a med not previously stocked for a new patient prescription? So right now, that I think would depend on which medications you have and when we set you up, because I'll tell you kind of right now, at least with like Central City, for example, Central City has a list of medications that Sandy knows she uses fairly often, and we send her a regular supply of those medications. If there are any medications that are a last-minute request, we can definitely fill them, but depending on your size, if you're a smaller clinic and we are having a transfer of the medications from one of our larger partners to you, I think right now I'll fill them probably once every 2 weeks, 2 to 3 weeks. But again, to work with, if it's a medication that's super urgent, we can definitely see what's the best process to set up so that if we know that we're regularly going to get those requests from you guys, that we know how best to fill them so that the patient doesn't have to wait very long. And Melanie, feel free to let me know if I didn't answer your question or you have additional follow-up question for that. I'll go ahead and answer your second question, which is, would service be available to those with high deductible plans to temporarily fill meds until deductible is met? The answer is yes. The meds are here to help both uninsured and underinsured patients. And we know that sometimes those high deductibles can be really taxing for a patient who is just trying to stay healthy and really can't afford that deductible in the time being. So as a safety net, yes, you are able to use those medications.
Awesome.
Great. So I guess we'll do, Matt, maybe one last call for any questions anybody may have. You can type it into the chat box like Melanie did, or you can let us know directly on the line. All right. Matt, anything else?
I don't think so. I really appreciate you taking the time to explain your awesome service to everyone.
Oh, thank you so much for giving us the opportunity, Matt. I will also, I mean, you have it as well, but I'll include our emails and contact our direct lines in case anybody does have questions following the conversation, or if anybody had RSVP'd and wasn't able to make it today. And that way they should feel free, you guys should all feel free to contact us at any time if you have questions or are interested in joining us.
Sounds perfect.
Okay. Thank you, everyone.
All right. Thanks again.
Thanks.
Thank you, Amy.
Thank you.
Bye.
Bye.